My name is Ariana Cruz, and I'm joining you today from the traditional and the unceded territories of the Coast Salish peoples, including the Musqueam, the Squamish, and the Tsleil-Waututh nations, where I get to work and play. And I am the Director of Sustainable Clinical Services at Vancouver Coastal Health. We're so grateful to have you here, and we're very excited to share these resources with you, resources that many of you have helped shape along our way. So our hope is that the SE-QI Toolkit and the SE-QI Spotlight will help make environmental sustainability a practical and also an everyday part of quality improvement. So thank you again for joining us. Just a quick logistical note, we will be recording today's session so that anyone who's interested but unavailable to attend today's live session can access it afterwards. So before we begin, I would like to introduce and acknowledge the SE-QI team behind this work. This has been a truly collaborative effort across several organizations, and in many ways, today represents the culmination of several years of learning, working together, and partnership. So from Interior Health, we have Christine Henderson, Coordinator of Clinical Sustainability, Amanda McKenzie, Manager of Environmental Sustainability, Dr. Ilona Hale, Medical Director of Climate Change and Sustainability. From Cascades, we have Nicole Sims, Executive and Training Lead, and Nabacan Knowledge Mobilization Coordinator. From Health Quality BC, we have Andrea Winuk, Leader of Strategic Initiatives. And from Vancouver Coastal Health, we have Dr. Andrea McNeil, Regional Medical Director for Planetary Health, Ania Chada, Research Assistant, and Shreya Ambrose, Analyst and Administrative Assistant, and myself. So you'll hear from several members of this amazing team today. And I also want to acknowledge that this slide represents only part of that broader community that we have been so grateful to work with and who have helped shape this work. So we're very grateful for everyone's contributions and excited to walk you through the journey and the resources today. So with that, I'm very pleased to hand it over to Dr. Andrea McNeil, who will open with a land acknowledgement and walk us through today's agenda. Over to you, Andrea.
Thank you, Ariana. And I add my welcome to that. It is thrilling to see so many of you here with us, and we're so excited to spend this next hour with you. Like Ariana, I too am joining from the unceded territories of the Coast Salish peoples, and I recognize that we're gathered virtually today from many different territories and traditions. So as we explore dimensions of sustainability together, I welcome you all to reflect on the lands that you occupy and the sacred obligation that we share to steward those. In BC, next slide, we were blessed to receive teachings from Elder Shane Point, who very sadly left us a couple of months ago, but he was very generous in his sharing of Musqueam knowledge. And Elder Shane taught us about Natsamat, which means we are one, emphasizing our connectedness with one another and with nature, our equal value, and our shared responsibility to care for all life. So with that interconnectedness in mind, we'll begin our journey today, next slide, by first explaining the genesis of this quality improvement resource, why and how it came to be, how it relates to and can be used with at least one other existing resources, although we think there's possible alignment with many, and we'll showcase the toolkit and hopefully inspire you with examples of how it's been used to date. Now, we'd love to get to know each and every one of you personally, but since that isn't possible, let's do a lightning round of Slido so we can get a sense for who's in the room today. So I'd invite you to go to slido.com, either on your phone or your computer, and enter the number that you see on the screen here, which will give you access to 3 questions. So the first one is, where are you joining us from? We just want to see what kind of geographic representation we have from across the country today. So log on to Slido and just let us know where you are. So far, we have a West Coast predominance, although Toronto has made an appearance. Quebec. Awesome. And Halifax, we're now coast to coast. Wonderful. Amazing. Real geographic diversity here. Still a preponderance of Vancouverites, but presumably people are just here for the World Cup. Awesome. All right. Feel free to keep putting your answers in. You may just be still getting logged on to the Slido, but let's go to our next question. We want to get a sense for who is joining us today. So what is your professional role? We want to know if you're a clinician of some variety, a sustainability manager, a quality improvement advisor. What kind of interface with the healthcare system does your professional role entail? Wow, a lot of physicians so far. Awesome. Different kinds of physicians, quality improvement specialists. Awesome. Lots of clinical professions represented here. Sustainability, QI. This is a really nice balanced group. Patient partner, wonderful. And some research representation. Awesome. And we have a registered nurse planetary health chair. What an incredible testament to the state of our world that position exists. That's excellent. All right, keep typing. We want to still get a kind of an inventory after, but our final question is, where do you fall along the spectrum of sustainability championship? So are you a neophyte? You're here in a discovery phase, want to learn more. You're already a champion or leader on the other end of the spectrum, or somewhere in between where you've had some involvement in sustainability projects or quality improvement to date, or are shepherding some things to an implementation stage in your organization. Lots of involvement. This is another incredible testament to the engaged health professions workforces and health workforce in general, that we have very few people for whom this is a new idea. This is a group that brings experience and expertise already. So we hope that what you see today will be of relevance to you in your professional spheres, and that this will help you with your sustainability efforts. Excellent. Well, it's a pleasure to have you all here today, and I hope this is truly just the beginning of our QI journey together. So I'll hand it back to Ariana.
Thank you so much, Andrea, and thank you to everyone who participated on those Slido questions. As Andrea mentioned, it is wonderful to see the range of roles and the different perspectives that are joining us today. And now we're going to move into the story behind the SE-QI Toolkit. How did these resources came to be? And it is my pleasure to hand it over to Amanda Mackenzie, who will walk us through this journey.
Yeah, thanks so much, Ariana. Great to see everyone on the call today. So, to begin, as Ariana mentioned, I want to reflect a little bit on the journey that led to the development of the SE-QI Toolkit. And this work really emerged from a real need in our health system and a shared commitment across several organizations to really rethink how we approach quality improvement. So why was the SE-QI toolkit developed? We recognized early on that most healthcare improvement efforts were not accounting for environmental impact. Despite, as we know, or many of us know, the healthcare sector is a major contributor to carbon emissions and waste and many other environmental impacts. We found that through engagement, teams were really interested in sustainability and eager to act, but they felt like they lacked some of the practical or structured ways to integrate environmental sustainability into their QI work. And so this toolkit was really created to bridge that gap, to make sustainability a measurable and an achievable part of everyday quality improvement. Some of the challenges we noticed that QI teams faced early on, before our toolkit was developed, was they felt like environmental sustainability was often not considered or added late or not at all in projects. And many teams felt like they lacked, the environmental expertise in order to do this work. And there really wasn't a standardized way that was utilized in Canada to identify or measure environmental impacts in QI projects. And I'll just jump to the next slide. Yeah, and at the same time across Canada, as we've experienced more frequent climate-related disruptions from wildfires, heat events, floods, supply chain disruptions, these events have directly impacted care delivery, leading to canceled services, operational strain, and risk to patients and staff. And we've seen in the past that improvement science can be an incredible solution when tackling really complex system-wide challenges like climate change. Quality improvement really offers a familiar and practical pathway for teams to make meaningful change on sustainability while strengthening care processes. And so I want to go to the next slide. And so, why did quality improvement become the path forward for us? Well, through several years of engagement with QI teams, we saw a clear trend. So you can see on the left in this wonderful illustration that Ariana did, there's growing interest in environmental sustainability, and it's incredible to see the support for this work. But that gap was there between the tools or resources in order to execute this work or for project teams to feel like they could do this on their own. And we did see a growing impact and desire to act. Teams were asking, what can we do? How can I make a positive impact on our patients, our communities, and our planet? So there was appetite and but a lack of practical tools to really reduce the environmental impact and harms to patient care. So QI felt like a really natural fit. Quality improvement teams were already familiar with this process. We also find that quality improvement focuses on things like reducing waste, improving processes, enhancing safety and patient outcomes, just to name a few benefits. So integrating sustainability meant teams could address environmental impacts using methods they already knew and trusted. And so the result was the SE-QI Toolkit, and it really emerged as a direct response to this need, giving teams a way to turn climate-related challenges into opportunities for better, safer, more resilient care in the future. And we hope that this tool really equips them with the structure and confidence to make meaningful action in the future. And so with that, I'm going to hand it back to Ariana. Thanks so much.
Thanks so much, Amanda. So that was really the gap or the opportunity that we were addressing. And in terms of the development of the SE-QI Toolkit, it is grounded in the SE-QI framework, which is really the result of years and years of work and conceptualization, drawing and learning from models from around the world, including the work of the Center for Sustainable Healthcare in the UK. So the SE-QI framework responds to the Canadian content and the context, and it positions sustainability as both a goal, but also an outcome of health quality and high quality care. So rather than introducing another competing priority or a different dimension of quality, this framework recognizes environmental sustainability as a cross-cutting lens across all the quality domains. And why is this approach important? This embedded approach we consider is specifically critical in our context because health systems are already under significant strain with limited time, limited capacity, and many, many, many competing priorities. So if sustainability is positioned as a separate or an additional priority, it can be very difficult for adoption and even more difficult to scale. So when it is embedded within existing quality improvement work, it can help teams prioritize, implement with current systems. It can also help manage trade-offs and also align with the current mandates of high quality care. So in other words, in strained systems, what sits outside the core mandates often struggles to scale. So the intent that we had with the SE-QI framework and the toolkit is to make sustainability part of how we define and deliver quality care and also the work that we're already doing. So this sounds good conceptually, but what does it actually look like in practice? What does this embedded approach look like in practice? So for example, if we look at the dimension of effectiveness, this dimension focuses on delivering evidence-based appropriate care that meets the patient needs, but this also means that it's care that avoids things like low-value interventions, unnecessary tests, unnecessary treatments, and in this way, a core quality dimension, in this case, effectiveness, already has those direct links to environmental sustainability. More concretely, we wanted to share with you an example that comes from St. Paul's Hospital in the next slide, where the team had the goal to reduce unnecessary monthly non-surgical glove use in their cardiac surgery intensive care unit. So this initiative had effectiveness as its primary aim, focusing on that appropriate use of gloves. So in the next slide, here we see the team's impressive results over the project timeframe. They increased staff compliance with appropriate glove use, and they also managed to reduce overall glove use by 53%. So in addition, this example strengthens the case for embedding sustainability into quality dimensions. So the team was able to report not only on that primary aim of reducing glove use, but also on the environmental sustainability co-benefits of the project. So by embedding an emission factor for a single glove, they were able to incorporate those environmental impact calculations and also demonstrate the emissions that were avoided through that reduced glove use. So with this example, this brings us to one of the central concepts of the SE-QI framework, and that also feeds and informs the SE-QI toolkit. And that is that this framework recognizes two complementary pathways for advancing sustainability. The first one is that this toolkit and this framework can be utilized and mobilized when sustainability is deemed as a primary aim. So those are the projects where reducing environmental impact is the primary aim of the project. However, we also recognize the second pathway, which is where sustainability is a co-benefit. So those are the projects where the primary goal, the primary aim is improving or advancing a quality dimension, effectiveness, safety, equity. And as those improvements occur, those environmental benefits can emerge alongside them. So two key ideas here when we talk about the SE-QI framework. The first is that sustainability is not considered as a separate domain or dimension, but it actually touches on all of the different domains of quality. And the second is that there's two different pathways in which this toolkit and framework can be operationalized as a primary aim or as a co-benefit. So given these characteristics, the SE-QI toolkit and the framework are going to be flexible enough to be integrated within existing QI structures and QI efforts. And that's why I'm so excited to hand it over to Andrea Winnock from Health Quality BC, who's going to speak to specifically the alignment and how this approach can be supported through existing QI infrastructures, more specifically here, the BC Health Quality Matrix. So over to you, Andrea.
Thanks, Ariana. That's great. So yes, exactly. Happy to see everybody and really share this work with you. It's just so inspiring. But then how do we actually put this concept into action? And so that's where I'm here to share with you a few examples of how we're aligning quality and environmental sustainability as a provincial organization, but also as a support to others in the health system. So we'll move to the next slide, but just a quick little overview of us at Health Quality BC in case you're not familiar with us. But we really have a purpose to improve healthcare quality across British Columbia. And so we're a provincial organization really here to build on the foundation of quality, to really help deliver the latest knowledge from work happening in the system and to really champion high quality care. And so really it's around this system-wide impact from this provincial approach. And so how we're doing that in this space, the environmental sustainability space, is we're working with those who deliver care and system leaders to help reduce environmental impact, shift clinical practices, and really help align decisions using the health quality framework that I'll talk about in a minute. But always kind of keeping that this work is grounded in evidence, shared learning, and a commitment to quality. So just a little bit about our journey. So how did we even kind of get to this place that we are right now? But back in 2023, we brought together clinical folks in the health system in BC who were doing amazing work. So what was that work that they were doing and how could we help kind of leverage and spread it? And so it was the first time to really bring people together in the space, which was such an inspiring event. From there, we kind of got to what are barriers and challenges and where are some really prime areas that we could help spread. And so then we hosted a low carbon, high quality care collaborative where we worked with clinical teams to really help try to spread those practices. And then just over the last year, we really honed in on this alignment with high quality care and environmental sustainability by strengthening our definition of quality. So when we say the word quality, what does that mean? And so we have a definition here in BC, and I'll get to that in the next couple of slides. But, I think it was just really about laying that foundation. And then system collaboration. And so again, kind of bringing this group together, we have now a provincial sustainable clinical services advisory group leaders in the space, change makers, and we're prioritizing efforts to help take a provincial approach to this work. And again, Amanda talked about this, Ariana, but we're talking about the co-benefits. And so this is work that's better for people accessing our system, better for people working in the system, the planet also, and then really trying to, as a system of a whole, cost efficiency improvements to really help support improvements in all of these three areas. So this was our initial BC health quality matrix, which we've been working off this common definition for years here in BC with these 7 different dimensions. And now what we've really done is put environmental sustainability, like Ariana talked about, not as a separate dimension, but something that is foundational to when we talk about quality, when we're thinking about quality, that environmental sustainability is there as a foundational component to all of these discussions. And so the framework, it looks like this, and you can access this on our website, but it's really a tool. So it's both a tool to spark conversations, but to help programs and services to plan for quality improvement as well. And so the 7 dimensions are across the top with the areas of care on the side. And don't worry too much about the text here, but just as an example of this is work that a team had done looking to improve respiratory disease management using low carbon inhalers. And so they mapped out the switch or the use of low carbon inhalers with the different dimensions and how it impacts environmental sustainability and supports both. These are dotted lines, so it's meant to be kind of flexible, interchangeable in terms of, things can go across, but really it's meant to be a tool. So something that you can use, you can, people can write in on here and really get those core pieces of your conversations down when you're doing any sort of planning for this quality improvement work. So this is just a way that we've done it here in BC. And something that we wanted to showcase and hope to inspire others that, this can be part of the conversation and in a formal kind of structured way. So just to kind of reiterate kind of more visually, but again, not a separate dimension, but truly embedded in how we think about quality. So thanks.
Great. Thank you so much, Andrea. It's great to see the alignment across the different bodies of work and how they continue to strengthen and reinforce one another in practice. And with that, we'll move into the core of today's session, the SE-QI Toolkit, what it is, how it works, and how teams can use it. So I'm very pleased to invite my colleague, Christine Henderson, to begin this section. Over to you, Christine.
Thanks, Ariana. So now we've heard lots of context on what inspired making the tool, what's behind it, and now let's look at what it is. So it's actually a Google form that guides you through thinking about environmental sustainability and how it applies to your project. So it teaches you along the way, and you answer a series of questions, and then it gives you a report with recommendations and examples, things that you can apply to your project to demonstrate your project's impact on planetary health and environmental sustainability, or maybe integrate new ideas to improve the environmental sustainability of your project. So yeah, and when you can apply the tool, so it can be applied to a project at really any stage. If you apply it earlier on, there's more opportunity to help it have it inform how you do your project. So like taking those environmental considerations into the formation and reducing the environmental impact of your project, for instance. But you can also look at it retrospectively, and that can be great for learning or showcasing the co-benefits that came along with your project for the environment. And then you can also use it as a training or capacity building tool. So it's kind of like an environmental consult for your project. And that can really help teams that are new to this idea understand and be guided through thinking about it. So the toolkit starts with step 1, and this is about identifying your project's overall alignment with environmental sustainability. And we did this using the Sustainable Health Systems Framework developed by Dr. Andrea McNeil, who's with us, and her colleagues. And so this framework has 3 core principles of prevention, stewardship, and decarbonization. And we've developed 5 questions to help guide you through which one best aligns with your project. So this is what the step 1 report or output looks like. This would get emailed to you as a PDF. And for, in this case, prevention is a primary principle of the project. And so what that means is that the QI project improves or maintains the health of patients or populations, which reduces the demand on health services. And that in turn helps relieve the environmental impact or burden of healthcare. And so this framework is really great because it shows how your project can be linked to environmental sustainability, even if you think maybe like, oh, I'm actually using more paper, this is worse. But if what you're doing is improving patient health outcomes, you're actually reducing the burden down the road. So it's a very comprehensive way to think about sustainability and how it applies to your project. Step 2 is digging a little deeper into the specific opportunities for your project. So this So based on these categories, so we've got prevention, stewardship and appropriateness, mitigation and decarbonization, adaptation and resilience, and then by specialty or treatment modality and specific opportunities there. So the toolkit asks about the relevance of these different areas and then provides recommendations, resources, and potential metrics based on what you deem relevant to your project. So this is what the step 2 report looks like. So you can see it shows you what you said, yes, the opportunity area, the question, recommendations, all written by our team, potential activity data, potential environmental data or metrics that you could look at, and then links to resources and highlighting calculators where they exist. Step 3 dives into the environmental metrics. Data is split by activity and environmental data being quantified environmental impact. So we focus mostly on carbon dioxide equivalent or climate change impact because that's the best developed environmental metric for healthcare, and climate change is the biggest threat to population health of our time. So we're focused on that one. And so there's some examples there of the things that the step 3 shows you how you might be able to calculate for your project. So the step 3 report gives you a description of what you're doing, an example of what that could look like, shows you where to find emission factors, and then the example calculation. And of course, we link calculators wherever possible. So this is an example of some of the calculators that are linked in the toolkit. There's lots more coming out all the time, and we will be updating the toolkit and adding them as they come available. So the toolkit itself is not a calculator, but it links you to a lot of them, and it really helps you think, helps you through the thinking part of linking sustainability to your project, and as well as getting you started with the metrics. And so we did all of this to support teams in addressing climate change and sustainability at the system and operational levels, making it easier to embed environmental sustainability into their existing work, including QI work. We wanted to provide practical guidance on how to embed sustainability and address the growing need for clearer reporting and measurement of sustainability metrics in healthcare. So yeah, you can think of this toolkit as a preliminary consult with an environmental sustainability team. And I'll pass it back to Ariana to talk more about how it was developed.
Thanks so much, Christine. And I think Christine said it beautifully, and also referring to the image that Amanda spoke to earlier, one of the key gaps that we kept hearing consistently was a huge gap between interest and action and the need to build that bridge. So we're hoping that SE-QI is designed to help address and start building that bridge. As Christine described, the toolkit gives teams a structured but a flexible way to embed environmental sustainability into the QI projects, whether sustainability is a primary aim or it is a co-benefit alongside other goals related to quality. And really the intent of this toolkit is not to create a separate process, but to actually help teams integrate sustainability into the quality improvement structures, but also the projects that are already in the go. We also wanted to make sure that the toolkit was not just useful in theory, but practical and also relevant across different Canadian healthcare contexts. So to do that, we completed a national toolkit validation pilot between December 2025 and March 2026. The pilot included 24 participants representing 14 organizations across 6 different provinces. And through the pilot, the toolkit really demonstrated that strong performance across key implementation domains such as usability, feasibility, acceptability, as well as appropriateness. And for us as a team, it was very encouraging to see because we wanted to ensure that the toolkit could support teams in real world settings and also across different organizations, across different roles, and also across different stages of readiness. Then in terms of adoptions, the toolkit is gaining traction across different levels. Here are a few examples that we wanted to share with you. At the national level, we're seeing opportunities through the CASCADES Practice Network, the SE-QI Working Group, as well as Healthcare Excellence Canada Extra Program, where this toolkit has been embedded in the curricula. At the provincial level, the toolkit is being shared through programs such as Health Quality BC's Quality Academy, as well as Ontario Health's Closing the Quality Gap. And at the local level, we're seeing integration into initiatives such as the Physician Quality Improvement Program, or PQI, at Vancouver Coastal Health and Interior Health, with future spread to Island Health, as well as opportunities like the Ottawa Hospital's QI grant competition. So it's very encouraging to see the toolkit is applicable, but it's also adaptable across national, provincial, and local context while still supporting a shared approach to embedding sustainability into quality improvement. So that was a quick overview of the SE-QI Toolkit. That was a lot of information. And at this point, we would love to hear from you again. We know that some of you have already engaged with the toolkit, whether it was the pilot or you were some of the early adopters. Well, for some of you today, this might be the first introduction to the SE-QI Toolkit. So we invite you to respond in the Slido. Have you used the SE-QI Toolkit? As this will give us a bit of a sense where people are starting from and also just how familiar the audience is with this resource. So 17% has used the toolkit in the past, 83% not, but interest. And then we also have a small percent that hasn't heard about the toolkit and might not be using it. But it's, again, very encouraging to see that this might be the first time that you're getting access to this toolkit. And we really hope that as the presentation evolves, you get a clearer sense of how the toolkit works and if it can support any of your work. So maybe we can move to the second question. We also want to understand how people are using it, or if you're one of those that haven't used it but might use it in the future, how does the toolkit adapt to your context? So for this particular question, we want to know which of these options you might apply the toolkit to for your own QI project, for a QI training program, for grant competitions, as a training or building capacity. So we're seeing a majority there around your own QI project as a formal QI pathway or capacity building. Also 26% around QI training. And for those that selected other, we would love to hear what are some of those other alternatives and context or opportunities where you feel this SE-QI Toolkit could be mobilized. Maybe if you can share in the chat, we would love to hear for some other options in which this toolkit can be mobilized. The range of responses, I think, really speaks to the flexibility of the toolkit. We designed this intentionally because we know that sustainability embedded QI is going to look very differently on each organization based on the structures, the priorities, and also the stage of readiness. So it's great to see this distribution and diversity. Okay, so with that, we'll now move from the toolkit to the SE-QI Spotlight. So the toolkit is what helps teams embed sustainability into the QI projects, and the Spotlight, it's what helps showcase those projects. And I'm very pleased to hand it over to Ania Chara, who will walk us through the Spotlight. Over to you, Ania.
Thank you so much, Ariana. I'm super excited to introduce the SE-QI Spotlights, which are a national repository hosted on the Cascades website designed to showcase sustainability embedded quality improvement initiatives across Canada. One of the challenges in quality improvement today is that much of our learning stays localized because, unlike research, QI work doesn't always have a structured way to be shared or indexed, which can limit its visibility and spread. As healthcare organizations increasingly integrate environmental sustainability into their improvement efforts, there has been a clear need for real world examples of what this looks like in practice. We developed the SE-QI Spotlights to address this gap by establishing a centralized space where these initiatives can be learned from and built upon. Our repository has three main goals. First is to capture SE-QI projects and experiences. Second is to share practical examples and lessons learned firsthand. And third is to connect individuals and organizations who are working in the space. Next slide, thank you. Please feel free to scan the QR code on the slides or click on the link that Nick should be posting in the chat to access the spotlights. So on our website, as you can see in this screenshot here, each spotlight profile highlights a unique initiative. We have two types. The first are our QI project spotlights that detail how sustainability opportunities were integrated into each specific project. These spotlights further include information regarding key resources and tools used, how impacts were measured through activity and environmental data metrics, the relevance of certain HQBC domains of quality, and where to go for more contact information. Secondly, the website exhibits are cases wherein teams are directly integrating the SE-QI Toolkit into their organizational programs in order to facilitate education. These are labeled as our training and capacity building initiatives, and they demonstrate how we can engage new clinicians in the realm of healthcare sustainability. Next slide. Our creation of the repository is ongoing, and we are currently featuring 11 pilot contributions from 5 provinces across Canada. Together, they demonstrate the versatility of the SE-QI Toolkit across diverse settings. We have examples from preventative vaccine strategies to instating reusable sterilization containers in the OR to optimizing antidepressant and inhaler prescriptions in order to target stewardship and appropriateness. The website dashboard, as seen on screen, displays real-time statistics from sustainability-focused QI projects, providing a brief snapshot of implementation trends, nationwide patterns, and areas of impact. Our hope is for more teams to begin submitting their projects to our Spotlight repository so we can expand in breadth and reach moving forward. And today we are extremely fortunate to have the opportunity to hear from 2 of our early Spotlight contributors themselves. I'll hand the introductions over to Ariana. Thank you.
Thank you so much, Anya, for walking us through the SE-QI Spotlight. And really to bring this to life, as Anya mentioned, we're very lucky to have 3 colleagues joining us today to share some featured examples of SE-QI in practice. So to start us off, and in the next slide, we have Amy Chang. She's Manager of Spreading Quality Improvement at Vancouver Coastal Health, and she's also the team lead for the CARE Collaborative, and Bianca Grosu, Quality Improvement Advisor with the Physician Quality Improvement Team at VCH. Together, they are going to share how the SE-QI Toolkit was applied within the CARE Collaborative and how it supported teams in identifying and strengthening the sustainability dimensions of their QI project. And in your screen, you can see a screenshot of their project. So with that, thank you so much for being here, Amy and Bianca, and over to you.
Great. Thank you so much. Thank you so much, Ariana. So a bit of context about our project before I hand it over to Bianca to showcase how we use the SE-QI Toolkit. The CARE Collaborative, and CARE stands for Comprehensive Approach to Reduce Emergency Department Transfers. It's a Vancouver Coastal Health and Providence Healthcare led spreading quality improvement initiative. And it brings together long-term care teams and key partners to improve care delivery and outcomes. And really the primary goal of CARE is to optimize care within the care home and reduce inappropriate and avoidable transfers to the emergency department by really ensuring that residents receive the right care in the right place at the right time. And over to you, Bianca, to showcase.
Awesome. Thank you, Amy. We're just going to head to the next slide. Awesome. So now that you know a little bit more about the CARE Collaborative, I'm just going to speak to some of its planetary health impacts. Using the SE-QI Toolkit, we were able to kind of strategize and quantify some of the CO2 emissions that we had already kind of predicted were there as a co-benefit of this project. And so we looked at 3 different components for this specific CARE Collaborative, the first being the actual transport from the long-term care home to the emergency department. The second was looking at the CO2 emissions related to the ER visit itself. And then the third, we looked at the residents that ended up getting admitted into hospital after the ER visit and kind of analyzing the CO2 emission related to their length of stay. And so again, utilizing the SE-QI Toolkit, we were able to kind of gather some numbers to quantify this. So we know that approximately 0.56 kilograms of CO2 emissions per kilometer were emitted from BC ambulances. And then we multiply this by our average distance from care home to nearest hospital, keeping in mind that each care home has, they have different distances and calculating appropriately. For our second strategy, we leaned heavily on the NHS sustainability ER model. And while this model doesn't kind of map perfectly to our project, seeing as, residents come into the ER via ambulance and not by foot, some components don't fit perfectly, we are opting to use the lower end of the range that was calculated for an approximation. So the NHS ER model calculates anywhere from 15 to 29 kilograms of CO2 emissions per emergency visit, and we would be multiplying that by the number of ER visits attributed to some of these avoidable transfers to get a quantifiable number. For strategy 3, we then took a look at residents who ended up getting admitted. And so again, through the SE-QI Toolkit, we know that an average, inpatient stay, particularly in a medicine unit, equates to around 35 kilograms of CO2 emissions. And then we would multiply that by the average length of stay for the patients that did end up getting admitted from some of these avoidable transfers. And really altogether, all of these funnel up to like a bigger CO2 number. And our goal is to essentially look at pre and post collaborative and compare those metrics and see kind of what impact this project has had on CO2. And again, with this framework and this tool, we're able to really not only come up with a game plan, but also quantify this number. So our impact is a bit more meaningful and it's easier to track over time as well. And it kind of maps nicely to different change ideas and seeing kind of what's helping, what's not. That's a quick overview. If anyone has questions or concerns for us, we're happy to take them. Thank you.
Thank you so much, Amy and Bianca, for sharing that fantastic example and for your experience applying the SE-QI Toolkit through the CARE Collaborative. We're very, very thrilled and grateful to have this initiative featured as on a spotlight, and I'm sure many other teams across the country are going to benefit from the work that you just shared. Now we'll move to our second featured example, and I'm pleased to hand it over to Ramses Prado. He's a performance improvement consultant at Providence Healthcare, and he will be sharing a bit more about his project on decreasing personal protective device failures. Over to you, Ramses, and thank you for being here.
Thank you very much, Adriana. Ariana, I am very, very happy to be in here. I am going to be giving you a little bit of my experience with the SE-QI Toolkit. And for that, I am going to be kind of presenting on behalf of the team who is behind the Protecting Care at St. Paul's Hospital. It's a project focused on improving the reliability of personal protection devices, or PPDs, in the mental health units. So what you are seeing is PPD. It's used by staff when a patient is escalating and they need immediate support. Now imagine this moment. A staff member is trying to de-escalate a situation. They realize they need help. They pull the pin of this device and nothing happens. That was the reality in our units. Between January and August 2025, PPD failures were occurring every 17 days across units and every 35 days in PASU. This represents a significant safety risk for both staff and patients when timely response is critical. Next slide, please. So what we did was to form an interdisciplinary working group and use a cause and effect analysis to better understand this issue. It became clear that this was likely part of a broader system issue, and given capital priorities, we focused on what we could influence. Our aim was very simple: increase days between failures in PASIO from 35 to 100 days in 6 months. Not perfection, just better kind of reliability within our scope. We started with a very foundational change, very simple, tighter inventory control. And this included standardized device identification and scheduled battery replacement every 3 months. At the same time, we address system-level factors like preventive maintenance of the code-wide system, identification of dead zones, improved communication with switchboard, and ongoing PPD testing. None of these changes were complex, but they were consistent, visible, and shared. Next slide, please. So as this project was taking shape, we had the opportunity to pilot the SE-QI Toolkit, which was particularly meaningful because for years we had been trying to bring a structured sustainability lens into the QI work at Providence. And the toolkit provided exactly that. Through its 3 steps that Sarah walked us through of this toolkit, it helped us to expand how we thought about this project. It identified the relevant sustainability principle this project was covering, which was stewardship and appropriateness. It pointed out opportunities and provided practical recommendations we hadn't considered, such as device life cycle management, considering the durability and repairability in future procurement, and thinking about system resilience during high-risk periods. It suggested also environmental metrics, some very simples like simple ones like estimating how preventing incidents could reduce downstream resource use, including potential impacts on bed utilization. But most importantly, the toolkit triggered a different kind of conversation where we were discussing rechargeable batteries, future design consideration for the new hospital, and better tracking of resource use. For example, currently we are gathering data of the use of the batteries during the pilot and comparing it against the same period during the previous year. So in this case, the toolkit didn't just add metrics, it expanded how define quality in QI. Next slide, please. So within the project, within the scope of this project, we saw improvement since December 2025. No PPD failures had been reported in PASU, but the most important outcome was not the result, it was the learning. It was seeing how the SE-QI Toolkit was helping us to generate ideas on how to implement environmental sustainability into our QI work. We learned also that it wasn't ever a device issue, but a system issue, that reliability depends on multiple interconnected parts, and improving outcomes requires shared responsibility across teams. And building on this toolkit, we now have a more complete view of improvement, one that includes safety, system performance, and environmental impact. As next steps, we are spreading inventory practices to other units, sustaining key elements like inventory control and testing, and continuing to integrate sustainability into QI work. Because ultimately, safe, reliable, and sustainable systems are essential to delivering person-centered care. Thank you.
Great. That was fantastic. Thank you so much, Ramses. And thanks again to Amy and Bianca for sharing your experiences and knowledge with us. It's really valuable to learn about your projects, but also very encouraging to see that the SE-QI toolkit is really helping teams in identifying that sustainability lens. For anyone who's interested in learning more, these projects are now available on the SE-QI Spotlight webpage, along with the contact information for Amy, Bianca, and Ramses. And we will also have some minutes at the end for any questions to our speakers or to the SE-QI team. So we'll now move into the final formal part of the session, which is our closing and next steps. We want to start by pointing to you some of the resources mentioned today. This includes the SE-QI playbook, which includes the broader framework and the context for this work, the online SE-QI Toolkit, and the SE-QI Spotlight, where you can explore the 2 examples that we covered today and some more across Canada. And if it's of interest, we encourage you to explore them, share them, and use them in ways that support your local context. And I can see that we now have them on the chat. Another way to stay connected if it's of interest and to continue this work is through the Cascades Pan-Canadian Practice Network, more specifically through a working group that's dedicated to mobilizing this work. It's the Sustainability Embedded Quality Improvement Working Group. This is a working group that is co-chaired by Healthcare Excellence Canada and Vancouver Coastal Health and brings together participants from organizations across Canada who are interested in mobilizing this framework and this toolkit. So if you're interested in joining or if you want to learn more, please feel free to reach out to me at the email that's listed on this slide. So that is what we prepared for you today. We know that that was a lot of information, and now we really like to open the floor for any questions that you might have for our speakers around the toolkit, the spotlights for our SE-QI team to address. Feel free to raise your hand or to type your questions or your comments in the chats. I think we have time for 1 or 2 questions or comments.
I also wanted to highlight that it's also available in French.
Thank you so much, Christine. Again, speaking to the importance of adapting and creating something that's valuable in our Canadian context, it is now everything available in both languages.
Ariana, a message has come in on the chat saying this toolkit looks amazing. In addition to providing the units of CO2 reductions, does it provide any comparables to help us conceptualize the magnitude of project impact, especially to a lay audience?
Yes, and I can see Christine already addressed that in the chat. I don't think it's now included, but again, I think the purpose of building and growing this community is to getting all of this feedback and taking all of the learning so that we can adapt and adjust the toolkit so that it keeps getting better. And this is a fantastic idea. So thank you so much, Tyler, for pointing that out.
That is a great idea, and we can have some fun with it. Like, prevents as much waste as 3 elephants, or just like, we do have, I could add kilometer equivalent for gas car kilometers pretty easily as well. So yeah, I do love that idea.
Fantastic. Any other comments? Is anything else coming through the chat?
Some questions about how we can find out who took part in the pilots.
Yes, I'm very happy to provide. If you have a specific organization that you're a part of and want to learn who led that work from your organization, reach out to me. My email, ariana.cruz@vch.ca, and I can definitely support with the connection. Thanks,
And there's another question here asking how the toolkit estimates environmental outcomes. For example, calculating greenhouse gas emissions avoided or kilograms of waste avoided. How does the toolkit account for differences in underlying data?
I can take that one or start. So the toolkit, there's videos, and I'm in them, and I go through a whole thing about interpreting environmental data, and it is full of error, full of estimates, and we make that very clear, and we provide recommendations for like not using too many significant figures. Like, it's a high level estimate and using language around that because it's not perfect, but it is the best we have. And every project is having or reducing an environmental impact. And so we're doing the best with what we've got, and just acknowledging that in the way that we describe the results.
Thanks, Christine. Any other question, Nick, that's coming through the chat or comments?
People are answering as we go, but is there anything else to say about funding for the toolkit? Fiona mentioned that where Cascades receives their funding from. Any other funding sources that you want to discuss?
Yes, Cascades has been the leading organization that made this possible. And then it was through the partnership of Health Quality BC, Interior Health, and Vancouver Coastal with in-kind support in terms of the expertise and time.
Great. And has there been any discussion about suggesting the toolkit be a part of accreditation processes?
Yes, that's a great question. We are having conversations with Accreditation Canada and HSO and sharing the existence of this toolkit, how it's been created and validated here in Canada. So we hope that it can be considered as one of the resources when helping advance sustainability now that it's more formally embedded through the different standards. If there's any other suggestions or any recommendations on how to move this forward through accreditation, they're very welcomed.
I think I know the answer to this question, but are you also open to international application of the toolkit?
Absolutely. I think our initial focus and mandate, it's really strengthening the Canadian context, and it was built that way so that it would respond to the different needs that we were seeing here in Canada. But if there are opportunities to make this transferable to other countries and to make it stronger that way, that would be something that the team, I'm sure, would be open to exploring. And I invite our many SE-QI member groups that are part of the call to jump in as well.
Seeing any further questions right now?
Okay, so maybe that takes us to the end of today's session. Thank you to everyone for joining us today. On behalf of the SE-QI Toolkit, thank you to our partners, to the pilot participants, to the advisors and the project teams that are now showcasing our spotlights. This has been truly a collective effort, and today's launch is an important and a very, very exciting milestone, but it's also just the beginning. So our hope is that these resources are going to continue to be improved and continue to support teams in making sustainability a practical and everyday part of quality improvement. We are, as always, excited to keep learning from all of you, to learn with you, to gather feedback, and to see how the toolkit and the spotlight evolve as more teams use them in practice. So thank you all again, and we look forward to staying connected. Have a wonderful Friday. Thank you so much.
Thank you, everyone.